clarification that, as Dr. Fauci said last week, getting vaccinated, obviously we want people to be vaccinated, but it's not a free pass to now do whatever we want to do. As in, it's not a free pass to resume all of our pre-pandemic activities, and that's because we don't yet know whether being vaccinated means that it will stop you from being a carrier of coronavirus. As in, getting vaccinated, we know it will dramatically reduce your likelihood of having severe disease and becoming hospitalized and dying. That's critical. And also, if we get enough people vaccinated, we will hopefully get to the point of having herd immunity, maybe put an end to the pandemic. That would be great. Of course, we're not there. But we don't yet know whether getting vaccinated means that you will carry coronavirus and potentially still be infected and be able to infect others. Maybe you have no symptoms. But I'm certain that no one wants to be the individual who's vaccinated, think that they're safe, and then give the somehow still carry coronavirus and give it to our loved ones. So I've been asked a lot when it comes to grandparents who are vaccinated, are they able to see their grandkids? Well, yes, they are, but they should still take precautions. Because even, first of all, it's not 100% protective. It may be 95% protective, but not 100%. And also, you don't want to be giving coronavirus to everybody else. So you should still follow some precautions. Outdoors, much better than being indoors. Wearing a mask still would be helpful, but maybe you can now go in for that hug that you haven't been able to. When it comes to two vaccinated individuals or two vaccinated families, I actually think that in that case, it probably is pretty safe for them to see one another. But just remember, though, that may only apply for those two families. If they are going to be expanding their circle to people who are not vaccinated, they are then substantially increasing their own risk and other people's too.
Yeah, and there was a congressman from Massachusetts, Stephen Lynch, who received both doses of the vaccine and has been diagnosed positive for coronavirus. Now, his symptoms are minimal right now, but it's not the case that you can't be infected with coronavirus just because you have been vaccinated. It's just a matter of, the severity, as you mentioned, Dr. Wen, of those infections. Let's go to Dana. She's calling from Baltimore. Dana, welcome to Midday with Dr. Wen. Oh, Dana dropped. We don't have Dana, but she, as I understand it from our director, Luke Spicknell, had a question about pods and the family. When you talk about seeing your family, there's a difference between family and the people you live with. Your sister, as Dana was going to comment before she had to hang up, your sister may be family, but if she's not in your pod, it doesn't count. She doesn't live in your house. So again, when you talk about these congregate settings, you're talking about people you live in the same house with, right?
That's right. And so your roommate is in your pod, even if they are not your immediate family. But your immediate family who live across the country or who otherwise are not in a pod with you, in a pandemic pod with you, would not be safe to see them indoors, correct? And just to clarify also about the member of Congress, when it comes to coronavirus, you don't get maximal protection from coronavirus until 10 days to 14 days after the second shot. I don't know how long it was when the member of Congress was exposed, but that's something to remember as well. That it's not as if you get vaccinated today and you're immediately immune. It takes time for those for that immunity to build as well.
Yeah, we just can't keep our guard down or let our guard down. It's absolutely true that we've got to just stay vigilant in all sorts of arenas here. Former Baltimore City Health Commissioner Dr. Leana Wen is an emergency physician and a visiting professor at the George Washington University School of Public Health. She's also a contributing columnist for the Washington Post and a medical analyst for CNN. We'll have more of the Midday Health Watch with Dr. Wen on the other side of a quick break. Before we go to that break, each week here on Midday, it is our practice to read the names of people who have lost their lives to violence in Baltimore City. We also post their names on our webpage. We do so to stand in witness to their untimely deaths and to remember their families and friends in their hour of grief. We get their names from a researcher named Ellen Worthing, the Baltimore Sun, and the Baltimore Police Department. So far this year, 27 people have been victims of homicide in our city. 4 people whose homicides were first reported before last week are Melvin Johnson, age 25, Ricky Martin, age 62, Tavon Anderson, age 46, and Brianna Rogers. She was 30 years old. 8 people were homicide victims last week. 6 have been identified. They are Kevin Wallace, age 32, Reginald Taylor, age 47, Daryl Oliver, age 55, Andrew Johnson, age 30, Angelo Baldwin, age 28, and Alyssa Traylor. She was 17 years old. It's midday. I'm Tom Hall. We'll be right back.
You're tuned to Your Public Radio, 88.1 WYPR.
I'm Peter O'Dowd. We'll have the latest on the response to the fast-spreading COVID-19 variants here in the United States and how countries around the world are coping with the pandemic and handling vaccine distribution. Those stories and the latest news next time on Here and Now.
You'll hear Here and Now this afternoon from 1 till 3 here on 88.1 WYPR. And tomorrow, wake up with Morning Edition.
It's Noelle King from NPR. With the COVID-19 vaccines, this new administration, and a lot more, it's important to get an update about what's going on in the world as soon as your day starts. The team at Morning Edition works overnight so that when you start your day, you're armed with the latest news from your community and beyond. So start your day every weekday morning with Morning Edition.
Morning Edition, tomorrow morning and every weekday morning from 5 until 9:30 here on Your Public Radio. WYPR members make our programming possible. Thank you so much for your support. Support also comes from the Pennsylvania Academy of the Fine Arts. PAFA now features the headline exhibit, Taking Space, Contemporary Women Artists and the Politics of Scale. Sourced entirely from PAFA's permanent collection, this exhibit examines the approaches of women artists for whom space is a critical feature. PAFA.org. This is Your Public Radio, 88.1 WYPR.
Welcome back. It's the Midday Health Watch with Dr. Lena Wen. I'm Tom Hall. Dr. Wen is an emergency physician and a public health professor at George Washington University. She also writes a column for the Washington Post. She's a medical analyst and commentator for CNN and a wonderful friend of this program. To join our conversation, we have Dr. Wen with us until the top of the hour, 410-662-8780. Our email midday@wypr.org, and to tweet us, it's at midday. WYPR. So, Lena, let me ask about this issue of vaccine hesitancy. One thing that's come up is employers, whether or not they can require employees to get the vaccine. The Society for Human Resource Management says that they can, in fact, require employees to be vaccinated as a condition of employment as long as certain criteria are met. As a public health message and as a public health expert, do you think that this is something that the Biden administration should push for on a national basis, or the Hogan administration should push for here in Maryland? Strongly encouraging, if not even requiring, if it could be done, employers to say, in order to work here, you're going to have to get a vaccine, even if you have some hesitancy about it.
I think we're a long way off from that point, Tom. Right now, demand for the vaccine far outstrips supply. And that's all across the country. Vaccine rollout has not been as quick and seamless as we might have hoped. And there's no way at the moment, when vaccines are in such short supply, that would make sense. It may be over time, when supply finally catches up And there are particularly high-risk settings, for example, nursing homes and hospitals. I could imagine that those would be the type of settings that there might be such requirements. And again, it's not unprecedented. Already as a healthcare worker, I mean, the flu vaccine is required for healthcare workers in a lot of different settings. And so having the coronavirus vaccine be required in those particular high-risk settings, I would imagine that might start first. I could also imagine over time that there might be businesses that require vaccinations for their clients in order to help other customers feel safer. You can imagine an airline perhaps requiring vaccinations, and I think many people might feel safer flying on such an airline. And so I think it might not even be mandates in a lot of settings, but rather, or mandates of employees in a lot of settings. But I think that the vaccine hesitancy issue is something that needs to be worked on in a number of ways. We have to be attentive to why people are hesitant. Some of the reason people are hesitant is simply that they don't want to be first. And so we're seeing this, for example, with some healthcare workers, that they don't want to be first, but now that they're seeing their colleagues getting vaccinated, they now want to get it too. And so I think some of that is going to go away on its own just by the passage of time. I think other things will require very attentive work, recognizing that there are communities that have been hurt and have long had distrust of the medical profession for good reason, and that trust cannot be built overnight. And we have to prove that we are trustworthy in order to develop that trust.
Yeah, I think what you're saying, we're already seeing happen in baby steps. There's a new Kaiser poll out in the last 24 hours indicating that there's less reluctance and less hesitancy about the vaccine than there was just a few weeks ago. Let's go back to the phones to Carol, who I understand is a physician calling from Towson. Carol, welcome to Midday with Dr. Wen.
Thank you. And thank you, Dr. Wen, for really emphasizing that we all need to do everything we can as individuals do to prevent catching and transmitting this virus. But what I wanted to ask about and point out, did I hear you say that the virus is replicating when it goes from person to person? I think what you meant is that the more people that have it, the more opportunities the virus has for replicating and mutating. The mutations happen when the virus replicates. If I catch the virus, it's multiplying, it's replicating, and it's copying its RNA, and it's making mistakes. Those are mutations. So a new mutation might arise in me. If I pass the virus on to somebody else, they could catch the form that's the mutated form or the old form, but then it gives a whole nother petri dish for that virus to be replicating in and chance of mutating. Isn't that correct?
Yes, you are exactly right. To make the point that the more the virus replicates, the more it's going to mutate. So the more we are giving the virus the opportunity to spread in the community, the more chance there is of the variants that are there becoming dominant and new mutations arising, creating new variants that may cause even more problems for us. So that's the point that you're making is exactly right.
Thanks for that call, Carol. And again, bottom line, the mitigation efforts that have been, or the mitigation strategies that have been talked about now for nearly a year, wear a mask, socially distance, avoid congregant settings, wash your hands. This needs to keep happening from all of us, whether we're vaccinated or not. It needs to happen as a daily practice for all of us. Let's go back to the phones to Dorothy, who's calling from Queenstown. Welcome to the show. Thanks for calling.
Thank you for taking my call. I have a question. In 77, I came down with Guillain-Barré syndrome. And of course, ever since, I never have gotten any shots, nothing. But my question is, how safe is it for me to get the virus, no vaccine?
There is no contraindication to getting the vaccine if you have a history of Guillain-Barré syndrome. And so it's something that you should certainly talk about with your doctor, but that is not one of the reasons why people should not be getting the vaccine at this time. The only very specific contraindication right now as to why you should not get it is if you have a known allergy to one of the components of these specific vaccines. So even if you have a food allergy, a medication allergy, or even an allergy to another vaccine, if you don't have an allergy to this specific vaccine, then you should be able to receive it.
We have an email from Robert along those same lines. How long before vaccination should you stop your blood thinners?
Should you stop your blood thinners? To my knowledge, that is not a contraindication either. I think it may be that you have a particularly high dose of blood thinners, in which case if you're told by your doctor you should not be getting any shots of any kind, then you should talk to your doctor about your specific situation. But certainly many people are on blood thinners. They're on Coumadin, they're on Lovenox, they're on aspirin, and that is not a reason for them to not receive a vaccine.
You yourself are enrolled in a clinical trial, I believe, for the Johnson & Johnson vaccine. What can you tell us about what's on the horizon for additional vaccines in addition to the Pfizer and Moderna, which are in pretty wide circulation already? I heard one report that said Johnson & Johnson expected to be able to deliver 100 million doses by June. That's not all that far off. What do you know about those additional vaccines that we may see come to market soon?
Yeah, so these additional vaccines are really important. I'm, by the way, thrilled about the data for Pfizer and Moderna vaccine. If I were not in the Johnson & Johnson study, I would absolutely not hesitate at all to get either the Pfizer or the Moderna vaccine right now. The fact of the matter, though, is that we have such limited supply, and these are 2-dose vaccines. And so having additional vaccines like the 1-dose Johnson & Johnson vaccine come online, and AstraZeneca and Novavax are also pretty close to having good results, I think will be really important. Johnson & Johnson just released their results last week. They are expected to submit for FDA emergency use authorization at some point this week. So far, what we've seen are the data from a press release, and so this is not peer reviewed, we're not seeing the actual data, but based on what Johnson & Johnson has released, the findings are really promising, because we're talking here about a 1-dose vaccine that's stored at normal refrigerator temperatures that could be stored in your average refrigerator for months at a time, which is very different from this kind of Arctic temperature that's needed for the Pfizer vaccine. And you can imagine your doctor's office, your pharmacy will have no trouble storing a vaccine like that. And certainly having 1 dose rather than 2 doses will simplify matters a lot too. So I do feel very optimistic about Johnson & Johnson. I think some people have pointed to the data saying it's 66% effective, it looks like, as opposed to 95% effective when comparing it to Pfizer and Moderna. But to me, the primary endpoint that I care about is whether it prevents severe disease. And it appears that Johnson & Johnson prevents severe disease in 85% of the cases. And very specifically, there were no individuals who received the vaccine who ended up getting hospitalized or died, which I think is really significant, because ultimately that's what we're worried about. We're not so worried about whether you get a cold-like symptom and a sore throat. We care about whether you get severely ill and need to be in the hospital or will tragically succumb to coronavirus. And so I'm optimistic about the Johnson & Johnson results. I think Novavax, AstraZeneca coming online will also make a big difference. And I'm sure we'll continue this conversation over time, Tom, but I just want people to remember that they should get whatever vaccine they have access to, because that's the name of the game at this point. It may be that we need to get boosters of even a different vaccine over time, but we need to get as much immune protection to the population right now. And of course, this is no time, to your point, to let down our guard. Everything we can do in order to continue to wear masks, avoid indoor gatherings, keep physical distancing will be really critical.
we're not going to have time to get to one of our callers who I believe wants to talk about the location of the shot. She says that she has a torn rotator cuff in both shoulders, so that hurts. She says she got the vaccine in one of her shoulders and it's been painful. Can the shot be given in a different location? Does it have to be given in the upper arm?
No, I mean, there are many other locations. This is an intramuscular injection, so there are other muscles that this can be injected into as well.
One quick question about a piece that you wrote in the Washington Post, and that this tension between equity and speed, because sometimes we're getting the vaccine to places where they're having a difficult time distributing it. How do you frame the question about what to favor, getting it out there quickly or getting it to the folks who are disproportionately affected?
I think you can do both. The key, though, is we cannot forget about equity. We have to be intentional about equity, or else we end up exacerbating disparities.
Dr. Lena Wen is a former Baltimore City Health Commissioner. We'll have a link to her essays in the Washington Post on our website, wypr.org/midday. You can also see her medical comments on CNN. Dr. Wen, as always, we very much appreciate it. Thank you so much.
Thank you, Tom.
That's it for us today. Coming up tomorrow, Dr. Sonia Sonolisis joins me. She'll discuss the Baltimore City Schools plan for a reopening for more in-person learning in a couple of weeks. Hope you'll join us then. Stay tuned now for Here and Now. It's on the way at the top of the hour. And later, be sure to download WYPR's podcast, The Daily Dose. I'm Tom Hall. Thanks so much for joining us. Stay safe, wear a mask, stay distant. Have a great day.
السلام عليكم. كي داير الاخوان بخير صحه لاباس. المهم غادي نحاول نعطيكم واحد يعني اخر مستجدات واخر ما تيقولوا فيه بعض الباحثين والعلماء هنايا في امريكا. والتاريخ ديال اليوم هو فبراير 2020 وهذه الساعه تقريبا راه شي وحده جو. المهم كي سمعتوا معايا كي كنتو كتسمعوا فهذا الراديو، فقبل ما نبدا تنسجل انا علاش بديت كنسجل، لانه سمعت شي حاجه اللي باغي نشيرها معكم، اللي باغي نشاركها معكم باش تاخذوها بعين الاعتبار. هاد المساله هادي وهاد السيده هاد الباحثه هادي ولا هاد الطبيبه اللي كاينه هنا في بالتيمور ماريلاند كتقول بان المشكله ديال هاد لي فاكسان اللي كاينين دابا عباد الله ما عارفينش، هاد الباحثين هادو ما عارفينش واش هاد الفاكسان غادي يخدم يعني بور توجور، ولا خاص كل عام بنادم يبدا يدير اللقاح، كل عام خاصو يدير اللقاح، كل عام خاصو يضرب هذيك المفتاحه، فهمتيني؟ مسألة أخرى الثانية اللي كانوا تيقولوا هو أن هذا الفيروس هذا متغير تيتطور، وكل إنسان انتقل ليه تيقدر احتمال عند واحد الاحتمال كبير أنه يتغير تاني. معنى آخر إلا انتقل بزاف ديال عباد الله، بزاف ديال الناس، احتمال ان هذاك الفيروس يتغير بزاف ديال الخطرات. مثلا الا انتقل ل 100 واحد، احتمال انه تكون لي 90 واحد عندها فيروس الاصل ديالو ديال كورونا ولكن مختلف. واش هذاك اللقاح غادي يخدم معاه الله اعلم الله اعلم. من المسائل الاخرى اللي ناقشوها في هذا الموضوع هذا في هذا السبق الصحفي ولا شو يقولوا لي الله اعلم، هو ان واش الدوله غادي تفرض على الناس اللي خدامين في القطاع، في بعض القطاعات اللي عندها علاقه بالزبائن، على اتصال بالزبائن، احتمال انهم يفرضوا على كل شيء يبدا ياخذ هذا اللقاح هذا. ما يمكن لكش تخدم الا ما كانش عندك، الا ما درتيش اللقاح. وهما ديجا تيقولوا بان بالنسبه للناس ديال الصحه، قطاع ديال الصحه، ف ضروري عندهم ما يمكن لهمش يخدموا الا ما خدوش اللقاح ديال البرد ديال الزكام. فبالتالي تتقول احتمال انه غادي يكون حتى هذه المساله ديال كورونا حتى هو خاص بنادم اللي خدام، خصوصا اللي خدام في قطاع الصحه، ضروري غادي يسميتو يتفرض عليهم انهم يديروا هذا اللقاح هذا. الاشكاليه دابا علاش باقي ما مفروضش؟ لان الناس ما عندهمش الانتاج غير كافي، ما عندهمش الدواء بزايد باش يفرضوها على عباد الله. ثاني حاجه كتقول هناك احتمال كبير، كاين هناك واحد الفرضيه كبيره انهم يفرضوهم على جميع القطاعات الاخرى، مثلا قطاعات ديال السياحه، الناس اللي بيخدموا في الشركات ديال الطيران، الفندقه، واحتمال الادارات العموميه حتى هي. ولكن انهم بيحاولوا يحبسوا يعني التنقل ديال هذا الفيروس، لانه تيتغير، وإلا التغيير تقدر تغير حتى الهيئه ديالو، فبالتالي بيوليو عندهم معضله مشكله كبيره. مسائل اخرى اللي ناقشوها هو انه كاينين الناس اللي ما حاملينش ما دايرينش الثقه في هذا الفيروس هذا، ولكن قالوا ان كاينين الناس اللي غادي يديروا الثقه، تياخذوا وقت شويه باش يثقوا في الفيروس، في اللقاح عفوا. داكشي علاش كيتسناو الناس يديروا اللقاح. وهذه المساله وقعت لهم حتى تيقولوا في القطاع ديال الصحه، يعني الممرضين كاين اللي رفضوا انهم ياخذوا اللقاح، حتى خدوه الناس اللي قبل منهم عاد قالوا اوكي حنا دابا حتى حنا ناخذوا اللقاح. تفاهمنا على هذه المساله هذه. هاد الساعه تيبان لي هاد الشيء اللي عطا الله هذا هو الجديد اللي كاين بالنسبه لي. انا غادي نحاول ما غاديش ندير هذا اللقاح هذا، ما عاد الا فرضوا عليا في شي حاله الله اعلم، مي انا 100%. المهم هو بنادم يدير الماسك بعاد على عباد الله بقدر المستطاع. ثاني حاجه هو بنادم يبعد على الماكله ديال المعلبات وهذاك الشيبس والبطاطس المقليه، الماكله ديال الاجانب دانون، ويحاول ياكل صحي فهمتيني، ويشرب مياه مزيان، ويتهلا في راسو، ويصلي صلاتو، ويتوكل على الله. الله هو اللي تيحفظ، هو اللي كل شيء. ولكن هذا ما كيعنيش خاصنا نديرو اللي مفروض، خاصنا نديرو المسائل اللي خاصنا نديرو، خاصنا ناخذوا الحيطه والحذر فهمتيني. وهذا الشيء اللي عطا الله. وخوتنا السلام عليكم، والله يجيب الشفاء الناس اللي مرضوا. هذا الشيء اللي عطا الله. وانا راه درت لكم هذا الفيديو هذا باش تشوفوا هذه الدنيا هذه كي دايره هذا في اليامات ديال الثلج اللي تيقولوا فيها الصداع، ونعاودوا نقشعوكم. السلام عليكم.